from Lagos, the nation's commercial capital. This is the news at 10, live from Channels Television. Reported tonight,
W.H.O.
Hello and welcome. Tonight, good news for Nigerians as Health Minister Professor W.H.O says the country has successfully blocked the spread of the Ebola virus disease. Enugu State Deputy Governor impeached for running poultry farm in official quarters. Rain of eulogies for Professor Dora as President Jonathan leads other dignitaries to a requiem mass held in Abuja. And Egypt brokers peace between Israel and Palestine over Gaza.
Stockbroker calls for more awareness in bond trading as market picks up.
Sports news: Nigeria's silver-winning under-20 women's team, the Falconets, have arrived in Nigeria after their heroics in Canada.
We have contained Ebola, with one patient left in isolation. This good news is coming from the Minister of Health, Professor W.H.O. It's day 38 since the Ebola virus disease was imported into Nigeria, and so far, 13 cases of EVD, including the index, were recorded in Nigeria. 7 of this number were successfully managed at the isolation ward in Lagos and have been discharged. This is an indication that thus far, Nigeria has effectively managed the disease.
It has been over 1 month since Mr. Patrick Sawyer, the Liberian-American, imported the dreaded Ebola virus to Nigeria. So far, 13 cases, including the index case, Mr. Patrick Sawyer, have been confirmed in the country.
As I speak to you, Nigeria has only one confirmed case of Ebola virus disease, a secondary contact of Mr. Patrick Sawyers and spouse of one of the physicians who participated in the management of the index case. She is stable, but still on treatment at the isolation ward in Lagos.
Meanwhile, out of the 257 under surveillance, 129 have completed their incubation period without any trace of the disease in them. Another 128 persons are still under surveillance. The government appeals to citizens not to be relaxed with the successes recorded so far.
You know, in Nigeria, once you say something is under control, people just begin to get wild again. If there is any benefit we have had from the intrusion of Ebola, into our nation, it's been the public health benefits in terms of environmental hygiene and personal hygiene. The campaign for hand washing, the campaign for using sanitizers and keeping the environment clean has been very, very useful. And today is sinking down, in our nation more than ever before. We do not want this to relax at all.
When the minister was asked to confirm whether the only case currently managed is a sister of the late medical doctor who treated Patrick Sawyer, this is what he said.
She tested negative. Repeat, she's negative. Repeat, she's negative. Repeat, she's negative.
Ebola has killed over 1,000 victims in Africa since the recent outbreak was discovered in Guinea 5 months ago. With death toll still high in some neighboring West African countries, treatment research and control efforts need to be intensified in the region.
Clearly, the government has remained vigilant as promised since the outbreak of the disease. In Lagos, Edo, Oyo, Cross River and Kogi states, teamwork has remained the winning formula. Our correspondent Mary Alale Yusuf gives us an update of the containment across the states.
Now, here in Lagos, the Commissioner of Health has also been speaking about the number of Ebola virus patients the state is managing in its isolation center.
On the
According to him, so far, there have been 331 contacts, 10 of whom were tracked down on Monday. 159 have been let go after a 21-day surveillance period. One confirmed and one suspected case remain in the isolation center. The commissioner has some advice for hospitals about cases they suspect to be Ebola disease.
Not everybody with a fever or hemorrhage has come down with Ebola viral disease. A situation where these cases are automatically referred to the mainland general hospital is not good practice. I appeal to our colleagues in the health sector, both in the public and private, to commence the management of these cases using universal safety precautions and only refer them if there is an indication so to do.
This town hall meeting, the University of Ibadan plays host to students and lecturers of the institution for this sensitization meeting. The guest lecturer assures those present that the university has what it takes to handle Ebola should it come their way.
And long before the Mr. Sawyer case, we've got reagents and everything ready to relay diagnosis. And we can do this within 24 hours.
And in the South-South, healthcare workers at this training session in the University of Calabar Teaching Hospital. The Chief Medical Director warns that the medical personnel are at the highest risk of contracting the Ebola virus disease. He has special concerns for the state as a border state and a tourist center. In Benin City, the Edo state capital, Governor Adams Oshomole sits in a meeting with representatives of the market women of the town. He expects them to be ambassadors of his sort, to spread the message of Ebola awareness and prevention. Their leader assures most effective broadcasters.
If you want to broadcast something, the market women, I sabi broadcast. Because when you're talking, maybe NEPA will take light. But we know the NEPA not they take our light.
And it appears the comrade governor is not afraid of the hogs. In the north, it's back to the grassroots in Kogi State with an NGO of nurses visiting the market and the taxi park.
Anybody where they sick now, before you carry them, make it providing medical certificate.
Some here had heard of the Ebola disease but did not understand much about it.
When this group came in today, they enlightened us about some symptoms, and now we know it much better.
These people have been taught how to protect themselves from getting the disease. Perhaps they too will spread the sensitization, as the Edo market women have promised to. The current run of success with containment efforts and management of the disease in the country certainly gives hope that with strict observance to precautionary advice, we could be out of the woods soon. Mary Alale Yusuf, Channels Television News.
Meanwhile, officials of the Nigeria Prison Service have promised to ensure that inmates who are awaiting trial stay free of the Ebola virus disease. At a meeting in Abuja, the Deputy Controller of the service in charge of administration, Peter Ekwendu, called for the improvement of sanitary conditions in all prisons. They are concerned that allowing the disease to spread amongst the inmates poses a serious threat to the nation.
Drive towards containing the spread of the Ebola virus disease amongst 65% of inmates awaiting trial is the reason behind this gathering, as the federal government, experts and private institutions have continued to discuss on how to contain the spread of the Ebola disease. They believe that the nation's prisons must be on red alert to check any occurrence.
The Acting Controller General of Prisons has promptly approved the formation of Ebola virus disease emergency response and preparedness committees at the national headquarters and at the various prison commands, zonal headquarters, and prison yards throughout the country. Awareness and sensitization on EVD has been created among the staff and inmates and are still going on.
No doubt the nation's prisons have become congested, creating room for easy spread of diseases amongst the inmates. But government officials say safeguarding the human rights of Nigerians cannot take place where the health of its people is at stake.
Prison is considered of persons who are vulnerable. Vulnerable in the sense that they are people under captivity permitted by law. Persons who are temporarily restricted
to one place. And they are people who need special attention and protection. There are people going through the process of rehabilitation so that they can be friendly reintegrated into the society when the excesses that took them to the prison are cut off.
For the past 1 month, the issue on how to manage the spread of the Ebola virus disease has formed the crux of discussions at various meetings. What Nigerians await to see in the days ahead is that decisions reached will translate into efforts that will stop completely the spread of the deadly disease.
The President has described the late Minister of Information, Professor Dora Akonyele, as a role model whose dedication to service should serve as an example to Nigerian women. President Goodluck Jonathan was speaking at a requiem mass held in honor of the late minister at the Nigerian Pro-Cathedral Catholic Church in Abuja. According to the President, it was a dedication to service as Director General of the National Agency for Food, Drug Administration and Control that saved many Nigerians from the dangers of fake drugs. Our State House correspondent Chukwuma Onekuse reports.
May the faith of our beloved sister inspire us for the rest of our days.
Christian faithful from all walks of life converge here to give honor and pay tribute to a great woman. Professor Dora Akonyele, who departed this world on June 7 after years of meritorious service to her fatherland. President Goodluck Jonathan and his wife were among colleagues, friends, family members, and well-wishers who came to honor her in the Requiem Mass conducted by John Cardinal Onayeko, the Catholic Archbishop of Abuja. President Goodluck Jonathan described her life as brief but eventful, known because of her unflinching service to the nation and humanity.
What makes endear you to the people is not necessarily the big offices we hold, but the service that you render, sometimes even at our lower offices. For my children, the children of our late sister, anybody who links you up as the children of Dora will naturally respect you. I want to assist you if you need assistance. Some of us who are holding these big positions, presidents, vice presidents, ministers, senators, we even pray to God that the day we will die, people will respect our children.
The clergy called attention to the legacy Professor Dora Akonyele left behind. They said Dora was the kind of person that impacted lives, be it in politics, public, or family.
But somehow she had a way of seeing beyond the ordinary, and she was not the kind of person you would have contact with and not remember.
Eulogies came from the husband. He's full of acknowledgement to all who kept faith with the family following the death of his wife after a protracted battle with cancer.
Dorothy has a message for this country, the message of love, message of courage, message of steadfastness. Even when she was deathly ill, she still went to the conference.
As they depart after celebrating her life and times in church, the prayer from here is that God grants her soul eternal repose, and that those legacies left behind by Professor Dora Akonyele will stand the sands of time. Chukwuma Onekuse, Channels Television News.
Professor Dora Akonyele, may she rest in peace. Now in part two, after the break, Minister for State Defense Musiliu Obanikoro dismisses report of a Boko Haram caliphate, says federal government will continue to defend its territory. Do join us again.